Habari ya asubuhi. So a couple of us have met a few days before, including those that are not from Tanzania. And I would ask those that are not in Tanzania to respond, not from Tanzania or not Swahili speakers. Habari ya asubuhi. Habari ya asubuhi. A hand of applause to our brothers and sisters. Honorable Minister and Member of Parliament, Mwalimu, Honorable Moni and Honorable Agnes Mara, Members of Parliament in Tanzania, but also sitting in the Health Committee, Honorable, in absence, Dr. Grace Magembe, Deputy Permanent Secretary, who could not be here. I hope the Director of Preventive Services from Zanzibar, Dr. Sally Slim, is here. Honorable Ambassador of the United States of America to Tanzania and your delegation, Dr. Michael Battle, sir. Honorable Dr. Mohamed Mangola, Regional Medical Officer for Dar es Salaam and your delegation. Founding members of the Africa Academy for Public Health and board members, Professor Mark Elliott, Chair of the Board of the Africa Academy for Public Health and the Vice Provost for International Affairs for Harvard University, Professor Jane Kim, Dean of Academic Affairs at the Harvard Chan School of Public Health, Professor Wafaya Fauzi, Professor of Nutrition, Epidemiology and Global Health at Harvard Chan School of Public Health, Professor Emeritus Jafet Kileo, Member of the Africa Academy Board, Professor Kaushik Ramaya, Founder of the Africa Academy for Public Health, Professor Till Baringhausen and your delegation, Director of the Heidelberg Institute of Global Health, Jessica Green, Director of the PEPFAR Coordinator in Tanzania, Dr. Mahesh Swaminathan, Country Director, CDC, Melissa Neil Barrett, Deputy Country Representative from UNFPA, representing Mark Bryan, who is unwell this morning, esteemed partners and collaborators from the ARISE network within Tanzania and outside Tanzania, heads of government institutions, representatives from local and international academic and research institutions, government officials, ladies and gentlemen, invited guests, all protocol observed. Good morning once again. Welcome all of you to the 5th Annual Scientific Symposium of the ARISE Network. We are truly honored and thrilled to come together again in this auspicious scientific event that underscores the ongoing collaboration between the Africa Academy for Public Health and our partners in Tanzania and outside, within the sub-Saharan Africa and beyond. The Africa Academy for Public Health was established in 2009. It is a Tanzanian non-profit, non-governmental institution, and we have been championing and aspire to become leaders in advancing public health priorities in sub-Saharan Africa. This we do through training, capacity building, and contribution towards knowledge policy translation. This symposium, with a theme, as I believe we are all aware of, is translating research into practice for adolescent health and nutrition in sub-Saharan Africa. It highlights our continuous commitment to bridging the research to action agenda, where we have a gap in terms of findings to action through our collaborative research, training and capacity building efforts in this network. Ladies and gentlemen, Honorable Minister, in this endeavor, the Africa Academy for Public Health maintains partnerships with various entities within and outside Tanzania, working with your Ministry of Health, working with the President's Office, regional administration and local government, local and international institutions, proudly including the Muhimbili University of Health and Allied Sciences, University of Dodoma, Hyderabad Institute of Global Health, and many others, as well as our sister organization, Management and Development for Health in Dar es Salaam. AAPH, in collaboration with the Harvard T.H. Chan, about 8 years ago, co-joined the foundation of the ARISE network. This network comprises of 21 member institutions from 9 countries, namely Burkina Faso. If you may raise your hands, colleagues from Burkina Faso. Wonderful. Colleagues from Ethiopia. Oh, Ethiopia, they will be coming after their official celebration. Colleagues from Ghana, they will be coming as well. Nigeria, Professor Ayo, wonderful, and Angela. Colleagues from South Africa, wonderful. And Tanzania, the ARISE network partners, Professor Vai, I see you. Zafa Plus from Zanzibar, Udom, thank you. And Uganda, wonderful, Professor Kwatude and Christine. So these are colleagues that we have worked for together in advancing the same and common goal of identifying critical gaps through vigorous research in a collaborative manner, where we also work to identify what are the possible opportunities for further training of research, especially around epidemiological methods, around public health, and the like. Today's symposium stands as a testament to our commitment and dedication to transforming evidence into actionable policies for a betterment endorsement of public health services into practice. It offers a unique platform of stakeholders to engage in discussions and collaborative efforts, drawing on the wealth of research and program implementation. This is an important point. I'm honored to again mention, and I appreciate the Minister for inviting members of Parliament who are key and central to advancing policy inclusion in the work that they do at the Parliament. So our hope is, with the work that we do, when it's translated and it is clear and it is brought up to the policymakers, important work that may contribute to moving from where we are to next steps. These very important people are key to ensuring that. I am honored to announce many colleagues who are joining us from Tanzania once again, and have highlighted the countries. But we also have several other partners from beyond the sub-Saharan Africa. We have partners coming from Senegal. I don't know if they're already here, I'm sorry. Germany, colleagues from Germany, from Europe. We have colleagues from Netherlands already. We have colleagues from Spain, Serbia, Switzerland, and the United States. Thank you very much. Looking at the agenda today, ladies and gentlemen, we have an opportunity to hear about the work that we're doing in partnership through the ARISE network, which has expanded to other colleagues in Europe and America. We will understand about the work done in innovations in health and programs, interventions for adolescent health and nutrition, as well as have a panel discussion later, as you can see in the program, to discuss on translating research into policy and adolescent nutrition health. With a continuing commitment to adolescent health and nutrition, we aim to foster a culture of evidence-based practice and policy recommendation. Ladies and gentlemen, as we participate in this symposium, let us recognize the critical importance of bridging the gap between research, practice, and policy. Adolescents in the sub-Saharan Africa face significant challenges that we are all aware of, and through collaborative efforts like this, we can make a positive change. Thank you for your continued support and participation and joining this annual scientific forum. We look forward to this continued engagement for better public health, as we say at the Africa Academy for Public Health. Ladies and gentlemen, it is now an honor, I'm greatly honored to welcome none other but our distinguished Minister of Health, Honorable Umi Ali Mwalimu, who has played a remarkable role in improving the health sector in Tanzania. And she has done this very well under the leadership of our very own President Dr. Samia Suluhu Hassan and various partners in advancing the health agenda in our country.